Hi, my name is Julie Pekarsky. I am a nurse consultant. In today's session, we will discuss the care of the patient with a urinary catheter. A urinary catheter is a tube that is inserted through the urethra and into the bladder to drain urine. The urinary catheter is inserted temporarily into the bladder to relieve the pressure from a full bladder of urine. The full bladder may be caused by a medical condition that does not allow the urine to flow out freely from the bladder. The inability to empty the bladder is called urine retention. For obtaining a sterile urine specimen, a straight catheter may be used. To cleanse or wash out the bladder by instilling sterile solutions and medications through the catheter tubing, this cleansing procedure is known as an irrigation, and a temporary catheter may be used. Sometimes the catheter may be used to drain the urine continuously. This means that the catheter will remain in the bladder and drain the urine through tubing and into a drainage bag. Times that this will happen will be when a person suffers from urinary retention that cannot be surgically corrected, when skin breakdown is caused or irritated by the urinary incontinence, when a terminal illness or severe impairment makes a bed and clothing changes uncomfortable or disruptive for the patient. For example, if a person has cancer, frequent repositioning when they're incontinent could be painful and uncomfortable for them. Therefore, they might have a catheter to drain their urine to decrease their incontinent episodes, and they would be more comfortable. Also, when a medical condition requires accurate measurement of all urine output, a continuous urinary catheter may be used. And then when a patient suffers from nerve damage caused by injury or a disease such as stroke, continuous urinary drainage may be used. Before we go on, I'd like to discuss the functions of the urinary system and the structures. There are two kidneys. They are organs that filter impurities from the blood. Ureters are two tubes that carry urine from the kidneys to the bladder. The bladder is a container that stores urine until the urge to void. The urethra is a tube that carries urine from the bladder to the outside of the body. I'd like to discuss the equipment that is used for the urinary catheter patient. We have different types of catheters. This is a straight catheter, and this is the one that is used to insert temporarily into the bladder. And it is used to obtain a urine specimen or to just empty the bladder of urine. When the patient has to have continuous urinary drainage, they will have a Foley catheter. Sometimes it's called an indwelling catheter or a retention catheter. And this is what the catheter looks like, and it will remain in the bladder. The catheter has a balloon at the tip, and this balloon will be inflated with sterile water, and you can see that it is being inflated right now with the sterile water, and this prevents the catheter from slipping out of the bladder. And as you look at the diagram, you will see how the placement of this catheter is in the bladder. The other urinary drainage equipment that you need to be acquainted with is for continuous urinary drainage is, here's the catheter we discussed, and it is connected to tubing and a drainage bag. This tubing is clear, so you can observe and report any characteristics of the urine. This will hang on the bed frame, and it has a little spout here that can be used to drain the urine. In order to prevent pulling of the tubing, a leg strap will be applied to the thigh. And this leg strap is applied to the catheter, is connected to the catheter after it's applied to the thigh, and that will prevent it from pulling out. In order to provide dignity and privacy for the resident, we will also use a catheter cover bag, and this bag will cover the drainage bag. It will be applied when the resident is at the bedside or in their wheelchair, or when they're walking, perhaps with the walker. Sometimes they will be applied to the walker. Let us now go over the principles of catheter care. Providing emotional support is very important for people who have urinary catheters. The patient may be embarrassed to have a tube draining their urine in the view of others. To help the patient maintain dignity, the drainage bag has a cloth cover placed over it. Emotionally, the patient may be upset that he or she has lost control of their bladder function. The patient may be fearful that he or she may never regain control of their bladder function. As a caregiver, you must be professional and use a matter-of-fact approach when caring for these patients and be sensitive to their needs. Also, you must provide an aseptic environment, and it must be maintained to prevent bacterial growth and development of infections. The system must be kept closed and sterile at all times. Poor aseptic technique can cause a urinary tract infection. Catheter equipment must at all times be handled with concern for patient safety and comfort. A licensed nurse or a technician trained specially to insert a catheter will use sterile technique. As a caregiver, you are responsible for maintaining the sterile drainage system and keeping the system closed. The responsibility of the caregiver when giving patient care, they must wash their hands before and after handling catheter equipment. They must apply gloves before handling a catheter, making sure that all connections are tight to prevent leakage from the catheter and prevent germs from entering the drainage system. Remember never to disconnect the urinary tubing from the catheter without permission from the nurse. Catheter leg straps should be used to prevent pulling on the bladder. Note that the catheter leg strap may not be used if the patient has a circulation problem, and also if their skin has irritation from the leg strap, it would not be used. Make sure the tubing is free from kinks and that the urine is flowing freely by coiling excess tubing and attaching the tubing to the bed linen with a plastic clip. Make sure the drainage bag is below the level of the catheter and the bladder. The drainage bag must be attached to the frame of the bed and not the side rail. The drainage bag should never rest on or touch the floor. Privacy and dignity is maintained at all times by covering the drainage bag with the cloth cover. Empty the patient's drainage bag before ambulating or transferring the patient. Move and transfer the patient carefully so as not to dislodge the catheter by pulling on the tubing. If the patient sits in a wheelchair, the drainage bag must be attached under the seat of the wheelchair. The caregiver is responsible for observing the characteristics of the urine and the condition of the catheter and drainage equipment. You must report the following to your nurse. Report to the nurse if there is any leakage around the catheter. This can be a sign of obstruction, bladder spasms, or urinary tract infection. The resident may report to the nurse that they feel that they have an urge to urinate and they still have a catheter in them. Please report this to the nurse.